My name is Mitchell, and we're going to do the POTS compression test, which is a fracture special test. So we have a suspected fracture site down here on the fibula, on this malleolus. So what I'm going to do is I'm going to squeeze the leg up here, and if there's any pain at the fracture site, then that would be a positive sign for the POTS compression test.
My name is Reed Newey, and we're going to be doing the long bone compression test. So for this, we're going to be checking for possible fracture, so stabilize both ends of the tarsal here. A little bit of pressure on both ends here, and if there's any pain at the fracture site, then that's a positive test.
Alright, I'm Shane, and I'm doing the vibration test. So you would find where the suspected fracture is on the bone, and you get this vibrating, the tuning fork. You want to put the tuning fork on the same bone, but not over the fracture site, and you're looking for pain, and that would give you a positive test for the fracture.
Richards are doing the percussion test, also known as the bump test. So there's a suspected fracture in the first digit on the left foot. So with this one, I want to hit the first digit away from the fracture site, and if there's any pain near it at the fracture site, it would be considered a positive test. So you just go like this, or you can do it with a tuning fork or any other hard instrument, just kind of tapping that toe, and if there's pain, that would be positive.
Now we're going to go through the Ottawa foot rules. So this is for suspected fracture in the midfoot area. So we're going to have Reed take 4 steps, and if there's any pain, that would be a positive sign for a fracture during those 4 steps.
Alright, next we have the Ottawa ankle rules. So if they have any point tenderness in the distal 6 centimeters of their tibia or fibula, we'll ask them to take 4 steps. If they're not able to support their weight during those 4 steps, we recommend that they go get an x-ray for possible fracture.
Now we have the anterior drawer test for the ankle, and this will be tested bilaterally. You want to test this for laxity in the ATF ligament, the anterior talofibular. So first you'll get a good hold up here on the shank, and you want to hold down here, and you're trying to slide anteriorly. And if there's any laxity in either of these, then that's a positive test.
Doing the Talar tilt test on Reed here, we'll be checking for laxity in the CF, trochanterofibular ligament. We'll be inverting and inverting the foot. So you can just grab the foot like this, or you can hold it by the leg by the shank as well. And we'll be inverting and everting the foot, checking for that laxity, compare it with the other one. And if there's more laxity in one, then it's considered a positive test.
Okay, now we're going to do the dorsiflexion maneuver test, which is going to test for a high ankle sprain. So what I'm going to do is I'm going to push the ankle into dorsiflexion, and pain over the syndesmosis would be a positive sign for the high ankle sprain.
Alright, next we're going to do the Kliger test. We're going to be testing for a sprain of the deltoid ligament. We're going to grab the leg right here, grab the bottom of the foot, externally rotate the foot. And if there's any pain, then that's a positive test.
Doing the squeeze test of the leg. So you'll find the malleoli, and you're just going to compress. And this is to check for a high ankle sprain. If there's any pain in the syndesmosis, that would be a positive test for high ankle sprain.
Doing the Thompson's test, this will be looking for a ruptured Achilles tendon. So we'll have the patient in prone position, one foot hanging over the edge of the table. What I'll do is I'll squeeze over the gastroc and the soleus muscles. And as I squeeze, if there's movement, that's a negative test. If there's no movement, that's positive. So as I'm squeezing, you can see that there's some movement, which means that the Achilles tendon is still intact, it's not ruptured, so it's a negative test.
Okay, now we're doing the Matless test. So what we're going to do is have the patient in the prone position, bring both of their lower legs up here, and we're checking for an Achilles rupture. So if the Achilles were ruptured for a positive sign, the foot would actually be in a neutral or dorsiflex position because the Achilles wouldn't be able to hold it up. So here we have a negative sign.